Hi, Stephen. Welcome to the Radical Therapist podcast.
Well, thanks very much for inviting me.
I appreciate you making the time and very interested in some of the ideas that you're putting out there. And I thought, I'd really like to be in conversation with you and explore those. And I'm sure our listeners are going to be really interested in some of these ideas. And I guess maybe I'd like to start by you have a particular interesting approach to constructionism and its significance in psychotherapy. And I guess maybe we set the stage with that. And like, how do you view constructionism in that context?
Well, the as we said in our previous conversation, constructionism is widely permeating all of Western intellectual thought.
Right.
And the idea that a lot of things are constructed, gender identity, racism, sexism, all that kind of stuff. Everybody's familiar with that idea. When it comes to mental health and psychotherapy, though, it's not simply constructionism that's important, although postmodern thinking and constructionism are obviously important. It's that you can actually envision therapy occurring in a different reality because of constructionism. So, without any fancy terms, I define reality into constructed reality and fundamental reality. And that's really important to the rest of the work that I'm doing, is understanding the difference between those two things. And before I get into that, though,
Hmm.
you can't really fully grasp that until you look at the work that's been done on whether techniques have inherent power and the power of privileged knowledge. Because until you actually deconstruct those ideas, constructed reality won't make full sense.
So,
So if you want, I could kind of
yeah,
sashay into that really quickly.
that would be awesome. That was one of my questions. You do have a critique of that, so maybe you can share that.
Yeah, you kind of have to start with that, or else the whole constructed reality thing feels like it's being built on sand instead of a solid foundation.
Yeah, right.
So the great psychotherapy debate, we're familiar with that term. Bruce Wampold wrote a book entitled that, and he's on the common factors side of that debate. The other side is specific factors people. Specific factors, as we probably remember from basic graduate training, is the idea that psychotherapy has common factors, most commonly seen as a therapeutic alliance with a wise and caring person, although other people have added other things to common factors. That's the number one. And then specific factors are the techniques and the underlying systems that differ from school to school. Psychodynamic versus CBT, systems versus humanistic, existential, and so forth.
Hmm.
So the great psychotherapy debate is a debate about whether specific factors have inherent power. And the field as a whole, of course, assumes they do. Because every time you take a workshop where you learn a new technique, whether it's DBT, ACT, whatever, you're endorsing the idea that learning this thing is going to make my therapy more effective. The research, however, doesn't support that. And I'll tell you, to understand how, you have to first follow a mini version of the history of the great psychotherapy debate. So the first move in the great psychotherapy debate is called the dodo bird theory, which again, everybody learned about in graduate school. And that's the finding from meta-analyses that when you do hundreds of studies, all the schools of psychotherapy work and they get equivalent positive outcomes. It's from Alice in Wonderland, all have won, therefore all must have prices. So the dodo bird is a real death knell for the specific factors adherence. And the reason for that is that if the dodo bird is correct, then schools that are really different, one says that everything's from the unconscious mind. The other one says the unconscious mind doesn't even exist. One says it should be individually centered. The other one says, no, you have to see people in the context of the system there. These are really different ideas. The idea that such different schools with radically different techniques would accidentally get the same positive outcome is just silly. So that's impossible to believe. So you have to go to the common factors idea that psychotherapy is a ritual and that all the change is coming from the common factors. Now, the specific factors people hated that idea, so they attacked the bird. And the attack had three basic components to it, one of which was the most important. But the first one was there are quite a number of studies where one approach is better than another. So if you look at single studies, there's lots of them that say this is better than that, seems to contradict the dodo bird. The second one is dismembering studies. And dismembering studies are where you assign a percentage of the variance of the change factor. So if people change, how much is due to their gender? How much is due to the techniques? How much is due to the therapeutic alliance? And if you do certain kinds of studies, you can assign a percent of the variance due to these competing factors. And most dismembering studies claim that about 15% of the variance of change is due to the specific factors. And then the final one is the most important, common sense. Everybody, including clients, especially clients, say, hypnosis really helped me, or CBT techniques really helped me, or DBT really helped me. And the therapists feel the same way. And the medical model is based on the idea that techniques have inherent power. You know, the medical model is assessment, diagnosis, application of evidence-based technique, improvement or resolution of the problem. And that's common sense, and that's what psychotherapy is founded on. So all those things they use to attack the dodo bird. The common factor people fired back and said, hey, look, a lot of those studies that show things, one thing is better than another, either had really bad experimental design, but most of them had what's called allegiance factor effects. Allegiance are when the investigator and the therapist think that one technique they're investigating is better than another.
And they're usually practicing that technique.
They're usually practicing that technique, right? Another thing they fired back with was the impossibility of creating a placebo therapeutic intervention. As most people, or many people know, you know, the best way to do studies about inherent power is to compare the experimental thing with a placebo effect, so that you get placebo effects for both of them, but the experimental only has its inherent power effect. The problem, which is kind of funny, is that when you try to do experiments that way in psychotherapy, the clients always know which is the placebo treatment and which is the experimental design treatment. If you make the placebo treatment strong enough, convincing enough that it convinces clients it's a real treatment, then the two always get the same results. They both work and they work equivalently. So that's another argument that the dodo bird is correct, is the impossibility of getting a placebo effect. Anyway, they went back and forth and argued, and they hit stalemate. Stalemate meaning the academic people running this debate didn't convince the other side. The field as a whole was always convinced of specific factors, and they didn't care much about the debate. They would read it a little bit, say it was kind of interesting, and then move on from it.
Yeah, right.
Because they were just practicing, you know, the medical model and believed that the techniques they were using had inherent power. So my work begins by trying to resolve the great psychotherapy debate. And the resolution is very common sense and very simple. If techniques have inherent power, then experienced therapists who know more techniques and who practice them more assiduously should beat out less experienced therapists. Similarly, trained therapists should beat untrained therapists because the untrained don't know techniques and trained ones do.
All right.
And the effect size should be significant because when you talk to everybody, they think their techniques make a huge difference and they think their experience has made a big difference. So it is really easy to test whether experience correlates with positive outcomes because in hundreds of studies, we kept track of the number of years of therapist experience. So it's real easy to put that variable right next to outcome and see whether experienced therapists got better outcomes. And the correlation between experience and outcome is 0. And I have a whole literature review, which you can get from my website, which has like 20 studies in it, but I'm only going to give you 4. That one is really important. That one alone, to me, finishes the whole thing. But listen to the next 3. They did a lot of studies with what's called paraprofessionals. Paraprofessionals work in treatment centers, usually in clinics, sometimes in residential treatment centers as well. These are people, some have degrees, some don't, but they have no formal training as therapists. If they have a degree, it's in history or, biology or whatever. And they might get a few workshops when they're working at the clinic. But essentially, paraprofessionals are, relative to licensed people, untrained and inexperienced. So they did 3 meta-analyses comparing the outcomes of paraprofessionals doing therapy with professionals. One study had like 50 studies, one had 113, one had like 65. In one of them, the professionals were slightly better than the licensed people. And in the other 2, they were equivalent. So that's another one that shows the training experience. The third thing I usually cite is I have some reviews of training and supervision effects. And they have reviewed lots of studies and they say there's no evidence that training correlates with better outcomes or that supervision correlates with better outcomes. And the last one is there's only 2 studies that I know that look at untrained people versus licensed people. Because even the paraprofessionals have a tiny bit of training, right?
Right.
A small amount of experience. But the famous one was the Stroop and Hadley one, where they took college professors and compared them with licensed people. They were both effective at therapy with the same results. That got replicated in 2018 by like 7. It was like Anderson et al. And they compared 4th-year graduate students in clinical psych with 4th-year graduate students in biology and history. And again, they all were effective and they got equivalent results. If you want to look at 20 more studies supporting this, I have it in an article, but it's pretty clear that there's no evidence for training or experience. Hence, we have to recognize that the specific factors people have lost and that the common factors people have won, which means that techniques have no inherent power. That's a really big deal. It means that what we're doing in therapy is a ritual, not a technique with inherent power. And that's a really important thing to recognize. One more thing because of the lack of training and experience effects, that doesn't just apply to whether techniques have inherent power. Psychotherapy, like all professions, has a privileged knowledge. Our privileged knowledge is the knowledge that we own as a profession. It includes diagnosis, client characteristics, all the systems, all the interventions and techniques, everything that's ever been written, all the research studies, the workshops, that's our privileged knowledge. That's what we're trained in.
Right.
That's what we gather more of when we get more experience. When there's no effects from experience or training, it means that everything that has ever been written or thought about psychotherapy is unrelated to outcomes. Now, that is rather mind-blowing, but it stands to reason. Now I'm going to stop and let you
Yeah,
respond.
and now everybody listening is probably like, well, what do we do now, right? And I do really appreciate the idea of like therapy as ritual. But I know you train, I think you have consult groups and stuff like that. I mean, how do you then begin to work with folks around the ritual?
Well, now we've laid the foundation for your first question is what do I think of constructed reality?
Yeah.
Okay, so let's define it first. Everybody knows what constructionism is in a rough sense,
Mhm.
but the most advanced constructionists are people that take a look at language and basically say anytime there's language, there's a whole lot of assumptions, and we never experience the world as it is. It's always mediated by the language we use.
Right.
So to them, to some degree, everything is constructed. I respect those people. I think they're smart and have contributions. That's not what I'm talking about, though. I define, along with Berger and Leckman, who originally popularized constructionism with their book in the 70s, Social Construction of Reality.
Mhm.
They said that there's fundamental reality, things that are true across cultures. How to build a suspension bridge, what temperature water boils at, all that, the tables and chairs, all that stuff. And then there's constructed reality, like what's it mean to be a woman? What's feminism? What's honor? What's the good life? Everything connected to meaning.
Mhm.
In their book, they spent a lot of time saying that when cultures define all that stuff, they reify it so that if you're inside a culture, it feels very solid. A real woman is like this. And you can see that in the right wing. They're struggling so much with this transgender stuff and
Yeah. Yeah.
gender. They're all flipped out about that because they want to say, no, no, we know. They love to ask people, what is a woman?
Mhm.
Which I think is hilarious. But at any rate, okay. So that's constructed reality. But reality, and this is the part that you really want to think about. When I said that everything that's been written about psychotherapy is constructive because of this research outcome, I have to define something just for a moment. Part of our privileged knowledge are ideas like restful sleep is good for mental health, or exercise tends to dispel depression, or most people do better if they have a social network, or getting a dog helps a lot of people. These are ideas that actually they're techniques that actually do have inherent power.
Mhm.
If you get restful sleep, you're likely to have better mental health. And knowing that and motivating you to get that's a technique with inherent power.
Mhm.
However, I argue that it's not part of our privileged
I
knowledge.
was going to say it's not privileged knowledge, right? Like,
No, because my sister-in-law, if I have lunch with her and she's not a psychologist, she knows all those ideas as
yeah.
well as I do. So I would say that the techniques with inherent power are part of common knowledge. Our privileged knowledge, like, you know, uh, what's a schizophrenic mother?
Mhm.
You know, my sister-in-law wouldn't know that, but that isn't actually helping me get better outcomes.
Mhm.
So it's only our privileged knowledge that we're getting rid of. But when you think about it, these are smart people that have created all of our privileged knowledge. They're really smart. And there's thousands of them. I mean, we're talking thousands and millions of articles, books, studies, workshops. I mean, it's huge. It's not minor league. Berger and Luckman say that in every culture, there's a mental health model that the practitioners believe is actually connected to truth.
Hmm.
And they get it mixed up with the fact that they're actually operating in constructed reality. And that's exactly what that research on techniques lack inherent power points toward. When the research says throw away everything that's been written, it doesn't mean that it's not valuable for the way we conceptualize mental health in our culture. Other cultures like conceptualize it as spirit possession. And if you told every client that you were going to exercise their bad spirits, they wouldn't want to come back for a second session. If you tell them that they're anxious because their father was critical and they're going to get rid of that neuroses, they will come back because that's the way they're used to thinking of their anxiety problems.
Because it's like, yeah, culturally bound, right?
Culturally bound.
Yeah.
So now we're getting into what is worth teaching. Now, constructionism is easy to grasp. Apparently not for the right wing all the time, but it's easy for pretty much everybody else to grasp.
Hmm.
Constructed reality is not easy to grasp. Constructed reality is enormously fluid and includes not only our rituals that we operate with, but includes the mental health conditions that we're treating. Now, I'm not saying that there's no effect on mental health from illness like brain tumors or hormonal imbalances, because all of us believe, most all of us, believe in a mind-body connection. So there's overlap between fundamental reality. But the vast majority of stuff we treat with psychotherapy, both the illness and the resolution operate in constructed reality, not in fundamental reality. And if you start thinking that way, you get an edge over the people that think it's in fundamental reality. So let me give you an example that's very concrete.
Yeah.
I was just talking about spirit possession.
Yeah.
So let's pretend we're both exorcists in a culture that believes all my mental health symptoms are due to malevolent spirit possession.
Mm-hmm.
You and I believe in bad spirits then because we're exorcists.
Mm-hmm.
And the clients believe in them also. Now you go away and you travel to England and you hear this radical idea that the spirits are really constructs and that they don't actually exist. So you come back from England and you can't tell everybody this because they'll like burn you at the stake.
Mm.
But you know now you're still an exorcist. You still have to do exorcisms because that's what everybody expects in our culture. But you have an edge over me. And your edge is you know the spirits aren't real.
Mm.
And you also know that my mental health stuff, as a client, is also a construction. Now, what edge does that give you over me that still believes in spirits? And answering that question is what I do in my consultation groups and training and all the rest of that kind of stuff.
Hmm.
Knowing that we're operating in constructed reality can give you an edge so that instead of being just an average therapist, we might push ourselves up to being an above average therapist, which would be terrific. And maybe some above average therapists will even become exceptional because you get an edge understanding this stuff about constructed reality.
What are some of the critiques that you experience in putting these ideas out there? Have you gotten pushback on?
Oh, every workshop.
Okay.
How could I not? You can't say this to people who've been
Yeah,
their whole career believing in
yeah.
techniques. And the first thing that almost always gets said is if we just do more research, we'll find out that techniques have inherent power.
Hmm.
They say it in a variety of ways, but they say, hey, we've only been looking for 100 years. And I say, you've been looking for 100 years, and you and everybody else thinks that techniques are really powerful and they make a huge difference. You're not looking for something small, you're looking for something big.
Hmm.
The other thing I always point out is the very results they're critiquing, that they say we need to get more research, are the same results that showed that therapy works. Remember, all
Hmm.
these studies about training and experience are the same studies that show that therapy works, period.
It does actually work. We just don't know why or how.
That's what, well, they say they know why.
Well, right.
It's a combination of common factors and specific factors.
Yeah, I'm thinking of this idea, like, you going back to the spirits analogy, and like, I'm thinking of, forgetting the word I want to use, but like some people, spirits are real, right? It is constructed, but it's reality, right? And
Sure,
so,
if everybody believes something that's constructed, it has a certain level of reality.
yeah,
If everybody believes a woman ought to be subservient and let her husband be the boss in the marriage, then anybody who doesn't believe that is going to get punished by that culture.
mm-hmm.
So is that real? Well, ultimate reality, no, but relative reality, absolutely.
Mm-hmm. Okay. Yeah, and it's just kind of an expanded view. It's almost, dare I say, spiritual in a way. It's like an expanded view of reality. Is that fair?
It, it's fair,
Is that the edge?
especially
Is that the
because,
edge? Right? Is that the edge? This.
well, most of mysticism and higher order Eastern thought is way ahead of the constructionists on this.
Hmm.
And they've been writing about constructed reality forever.
Yeah. True. Yeah.
Even their concept of Maya, which means illusion in Sanskrit, is the nature of the world that we live in. And what they're talking about there is that we take constructed things and confuse it with fundamental things is the essence of Maya. So,
Yeah. So I have a lot of like, therapists in programs right now, newer therapists that listen to this podcast. I get their emails, so I know kind of, I get a lot of that. What advice would you give to new therapists that are spending a lot of money, quite honestly, in graduate programs, uh, learning a lot of this privileged knowledge? But how would you help them integrate your ideas and perspectives into their practice?
well, the first thing I would say is common sense, which is each culture has a way to get certified as a healer.
Yeah, right.
Ours has that. And so please cooperate with it. Learn everything you can and have as many positive experiences as you can. And then get out in the world as a licensed person where you have more independence. Trying to do radical things when you're still being supervised and evaluated by supervisors who might not be that happy with those ideas, that's like pushing everything upstream, and I don't recommend that.
Mhm.
So I recommend a kind of quietness about some of the more radical ideas
Mhm.
until you're free from the licensing process.
Mhm.
After that, there are always people that are looking at therapy from different angles. Obviously, that's what put your podcast, the title of it,
Yeah, right.
Radical Therapist. And there are a lot of people that are sympathetic. I
Pushing.
have to say,
Yeah.
though, that um, the two main constructionist psychotherapies, narrative therapy and collaborative therapy, I'm not very fond. I'm fond of a lot of things about it, but what I'm not fond of is they still believe in techniques.
Hmm.
And I think that any postmodern or constructionist school of psychotherapy has to start by not believing in techniques. And when they believe in techniques, you can't really get into the actual freedom
Hmm.
of constructed reality.
Yeah,
So
yeah, I get that. I mean, I might say yes, I think at a fundamental level, but I think people that get it go beyond. It isn't about techniques. I think it's about language. I think it's about ritual. And I think it is about some of these more common practices that are unprivileged, that are getting reduced to. Just as somebody that's, I'm kind of invested in narrative therapy, so I'm just, but
I think narrative
I get
therapy
the
has moved the
critique.
whole field along,
Yeah,
and I'm very grateful.
yeah.
It's got some brilliant thinking in it.
But this is why I'm attracted to your ideas as well, because I think this is the thing. There is this, you know, there is a problem with the training and the supervision and all the stuff that's going on out there. And I think and having been able to practice more post-structuralist, postmodern constructionist therapies, I've had these. I can, this sounds true to me, right, or accurate to me.
Yeah.
So
Well,
yeah,
the research is pretty, you can't really debate it.
yeah,
The second thing that happens in my workshop is people look, kind of get glazed eyes and say, that's very interesting. And then they walk out
right. Yeah, and I think
because there's no slot to put it.
no, and the field's so dominated, like you said, by the medical model, and it's hard to escape, right? And so you really do need community in some way, and that's why I do the podcast and we do events and try to put ideas like this out there and give them space and air. Yeah.
Right.
So, I
But
had
let's look, for example, collaborative therapy is famous for flattening the hierarchy.
right.
They just really believe that hierarchy is a terrible idea. Now, to me, that's a technique because the relationship that you have with a client ought to be based on the needs of the client, not your principled idea that all
Yeah.
therapeutic relationships should be flat. If you walk into it with a pre-existing a priori idea, that by definition is a technique that you're going to impose on the client. We've all had clients that really appreciate a flattened hierarchy relationship.
Hmm.
We've also had clients that change faster if there's some level of hierarchy.
It's true. Yeah.
And if the hierarchy, people who are going to do work with, let's say, teenagers, or let's say 10-year-olds, if you believe in a flattened hierarchy and you're doing therapy with 10-year-olds, you're going to run into some problems
Hmm.
because some of what you want to do. The other thing that I think is missed with that flattened hierarchy, I know this is funny because it's so obvious, but I was just at a conference where there was a group of psychologists talking about psychotherapy integration. Could we find common factors that unite all the different schools? And two of the psychologists on this panel I was on, they were talking about mechanisms for change inside the client. And they were making the case that memory reconsolidation is a really great mechanism for change. And I think most of us would agree memory reconsolidation, really interesting, great mechanism for change. And I said to them, one of them said, as far as they know, that's the only mechanism for change that they really think is true.
Hmm.
I said, that's interesting. What about the mechanism that human beings get influenced by other human beings and just asking a human being to see something differently, a bunch of people will just comply with you? They looked at me like I was from Mars with that idea.
That's great. So are
I
you,
think that's hilarious.
yeah, are you, in regards to supervision and training, are you like a deliberate practice person like Scott Miller, or who is also grounded in common factors? How do you,
Well, I love Scott Miller, and I'm very grateful to all the work that he's done that has, you know, created a new foundation for people. I just think he's terrific.
Mhm.
And I think looking at his fit model and his deliberate practice model, which he ties very tightly to the fit model, so that he's got a kind of a theoretical model that where the tweaks, the deliberate practice comes directly from the feedback from the clients.
Hmm.
So the place that Scott and I differ is that he says, learn anything you want, and then come here and we'll teach you how to use fit and deliberate practice.
We'll get you better at it, kind of thing.
We'll get you better at it.
Yeah.
And since I believe that what is being learned really confuses people and gets them stuck in the assumption that fundamental reality is going on, that's where Scott and I part ways.
Hmm.
I think that I think it's great. I think he's making a big contribution, but I think that he's missing something that happens when you say to people, all the problems and the solutions are in constructed reality. He also isn't pushing as much as I do for what Wampold calls persuasiveness, what I call charisma. Because Scott Miller wrote an article about super shrinks. That was a very nice article
Hmm.
where he tried to make the case that people become super shrinks by a lot of hours and a lot of deliberate practice. Good article, I recommend it. I have a different take on super shrinks. I think super shrinks are people that have a lot of charisma, and B, a tool they've developed that puts people in altered states. And when they get in the altered states, that therapist, the therapeutic wizard, the super shrink,
Hmm.
sees them as entirely fluid and then simply asks them in very simple ways to be different. The best analogy of that is in the 1950s, after World War II, clinical hypnosis was being introduced
Hmm.
in the United States. I had a professor in my graduate training named Jack Watkins, who was a contemporary of Erickson and knew Erickson. He used to say Erickson was very talented, but it was irritating eating breakfast with him because he kept trying to make, unconscious suggestions to pass the butter. And it felt like he was always trying to get you to do something. But be that as it may, the one thing that Watkins passed on to me and other hypnotherapists, especially in the 50s, they believed that this new technique, hypnosis, and the altered state, that anything was possible in it. They had no idea of its limitations. And they felt like once a person was in a trance, anything could happen.
Hmm.
To me, that was a stand-in for constructed reality.
Hmm.
They needed to get people hypnotized in a trance state, and then they had a lot of assumptions that were similar. What I want is regular therapists to recognize that people have normal states, secular states, and they have altered states. And when things are altered, they're in constructed reality, and lots of stuff is possible.
Lots of possibility there, right? Yeah, we're gonna. This is you maybe need to write that book. This is a longer conversation, but okay. A couple more questions. What does this mean for our education systems? I mean, there's a lot of critique of that now, and I work with a lot of students, and the costs are skyrocketing. The hoops to jump through, are expanding, and the education they come once they start practicum, meaning they start seeing clients, they realize that the education they're receiving is not helpful to what they're doing currently. So I hear that too, and so which I agree with. But I mean, is this just too big of a thing that change is going to be hard in any of that, or what are your thoughts?
No, I think it's going to go exactly like most new ideas, which is there'll be a few early adopters who try to do something
Yeah.
experimental, and
Do you
they'll
do you think we even that people are going to abandon the licensure process and start doing like you said?
no. I
like
don't,
paraprofessional or peer or
no, I don't think that, because what Berger and Leckman wrote
hmm,
is that every culture has to deal with mental health, and they always have a subset
they
of
all have a process.
people that
Yeah,
certified,
yeah, that makes sense.
because as Jerome Frank said, one of the four important points in his change model was that the therapist is certified by the culture, by license, having a nice office, dressing well, being called doctor. That's our certification.
Yeah,
But other cultures just have different certification.
yeah.
We'll always have a certification.
Okay. Yeah, and you mentioned Jerome Frank because I've been, researching your work and stuff. I picked up a book, Psychotherapy in the Human Predicament. Jerome, I haven't read any Frank, so I wanted to share that, and that leads me into my next question. I like to ask all my guests this question: is what books or ideas or film or music or whatever is what's capturing your attention these days? What are you
Well,
excited
I
about?
do read pretty much everything Scott Miller puts out,
Hmm.
because I think he's really a very sharp fella. And even if we've diverged, I still think that his critique of standard psychotherapy is really important.
And he has a
Even
large
though he,
audience, so that critique is important too.
yeah,
Yeah.
that stuff is really, it's really good. Um, the deliberate practice, they have a simple idea that if it's easy for you, you're not going to get much better. You need to do the things you hate to do and get better at those. And so the way they put it, deliberate practice tends to be effortful, intentional. You need a coach to kind of force you to do the stuff. Because if you just go out on your own, you always just get attracted to doing what's easy for you.
Mhm.
I totally think that's a logical thing, but I don't think that that's the best way to get best in constructed reality. In constructed reality, you want to feel where you flow with your charisma and with getting the client kind of loose and flowing. And so in deliberate practice, they literally say the flow is bad.
Oh, wow.
Flow is bad.
I didn't know that. Yeah.
They hate it, because flow to them just means that you're doing what you're already good at and you're not going to get any better.
Mm.
I understand their point. I think there's a lot in what they say, and I think they're missing a major point, which is there's a certain kind of flow that happens in constructed reality that's different than just doing things you're comfortable with. If you're a CBT therapist doing anxiety, or a DBT therapist, and you have, you know, a manual and you have
Mm.
tools and you're gonna give, to me, that's the kind of flow that is bad.
Mm.
But if you really are out in the wild west of constructed reality and you've said something that has put your client into an altered state, it's kind of like you're guiding a psychedelic trip.
Mm.
If you're guiding a psychedelic trip, you don't want to tell people do things that are hard for you.
Mm.
You want to say, practice more intuition, say yes to it, go with it. Once they get all untethered, you have to actually cultivate something else than doing things that are hard for you.
Okay. All right. Last question. How can people find you? And I'm going to link your website on the show notes. But how do people find you if they want to see more of your work? You do have a YouTube channel
Right?
um, under your
Right.
name.
The YouTube channel right at the moment is some of my latest work.
Yeah.
I'm currently writing some articles. I've just written one on, there's some interesting stuff coming out of behavioral genetics that is helping loosen up the way we think about trauma,
Mm.
which a lot of psychotherapy, I think it's hilarious when people say, I do trauma centered therapy.
Mm.
I I don't really know anybody who doesn't do trauma-centered therapy.
Yeah, it's trauma informed and all that stuff.
Trauma-informed, trauma-centered. Exactly.
Yeah,
But
that's what we call capitalism. That's
it
marketing.
sounds really good, doesn't it?
Yeah, yeah.
But but I think even though the concept of trauma is absolutely centered in our Western view of mental health,
Mhm.
the Western view of mental health basically, where these other cultures like might have bad spirits as the center point, our idea of pathology, psychopathology, is it's all bad history.
Mhm.
There was trauma in your past
That's our
and
constructed reality.
modeling.
Right?
Yeah, so we really believe in history.
We do.
And history begets psychopathology is our core belief that is equivalent to other cultures who might believe your covenant with God has gotten twisted, or you don't have enough spiritual substance like mana,
Mhm.
or bad spirits have taken you over, or an evil eye. They have different core explanations.
Mhm.
Ours is bad history caused all your problems.
Mhm.
Anything that helps people deconstruct that helps them get into constructed reality. So it turns out that there's a guy named Robert Plomin out of behavioral genetics that is coming up with some very exciting new stuff. It's very scientific because it's genetics,
Mhm.
but it deconstructs this idea that all psychopathology comes from history.
Mhm.
So I've written some articles and I have a workshop about that. I have another one that I'm working on right now, which is, lots of people have looked at therapeutic wizards and said, if we could figure out what they do and copy it, we could be like them.
Right.
Or if we interview them and find out, listen to their explanations. And as we know, even though that's a very logical thing, it's pretty much been a dry well.
Mhm.
Hasn't worked out that well. Nobody's all that good at copying them. But when you start by looking at therapeutic wizards with the idea that techniques don't have inherent power, you get a completely different view of therapeutic wizards. Because almost all the people who are looking at the therapeutic wizards are trying to distill their techniques because they're unconsciously operating in the medical model.
Mhm.
If you start right out by saying they're changing people, but it isn't their techniques, you have a chance to look at what they're actually doing. And that's another way to get into constructed reality.
Awesome. Okay. Well, thank you very much, Stephen, for making the time. And I will, audience, I'll have all the links to stuff in the show notes. Please check it out. And I look forward to seeing what you do next. Be on the lookout for those workshops.
Okay, thanks very much. I appreciate it.
Yeah, appreciate it. Thank you.
Okay, bye bye.